Hi, welcome back to my YouTube channel. By now you all know me, but if not, my name's Mario. I put out videos primarily on clinical research, and this is going to be a clinical research video, and it's going to be all about how to effectively write queries as a clinical research associate. This is a continuation of my last video. In my last video, I talked about source data verification. Something that goes hand in hand with source data verification is issuing queries. So we'll talk about that in this video. Before I get started, as always, I need to remind you to please take a moment to smash that like button and to subscribe to my channel if you haven't done so already. To all of you that have subscribed, a big thank you. All right, so let's get started talking about queries. So I took an article that I took some notes from, and I have some of my own ideas. I just want to credit the article to start. This is from a 2011 article in First Clinical Research. That's what I used to supplement what I had planned to present on queries. So, as I mentioned, between clinical data and statistical analysis, we deal with lots and lots and lots of data queries. And the goal is to, when writing a query, is to make sure it's understood, but it's not so detailed that it directs the site to do something specific. So you want to strike that fine balance between making sure you include enough information that it's understood by the site, understood what they need to do, but not putting in so much information that the site doesn't need to refer back to the source. And that is how you would generate an effective query. So before I talk more about the CRA writing queries, I want to mention where queries can potentially come from. So one of the first places sites may encounter queries is from system checks, edit checks. They're called different things. Sometimes people refer to them as system queries, auto queries. But essentially what they are is programmers that look to try to flesh out things that are inconsistent, missing, or illogical. Let's just take an example. Let's say I put in a blood pressure, systolic blood pressure of 400, and an autoquery for that may say, please verify value. Value is not compatible with life. So you might see something like that just auto-generate. So those are the auto-generated queries. Another place that queries may come from is from data management. Data management is responsible for an ongoing review of data, and data management does issue queries. And then the final place you see queries is from CRAs coming to the site or doing remote monitoring and issuing queries. Sometimes remote monitors may also have the ability to issue queries. So those are all the potential places that you might see queries being generated from. But we're really going to focus on the queries that are generated by the clinical research associate and how they should be written. So queries need to communicate effectively, and the successful query needs to be understood. So those are your main goals. So how do you accomplish this? Well, there's a multiple step process to accomplish this. The first thing is make sure you're telling the site what is reported. I know this might seem like a little bit of overkill because you're writing the query on a certain data point, but it's always helpful to start with the wording as per EDC, which is what you're looking at. This is reported this way. Let's use the blood pressure example again. As per EDC, the systolic blood pressure is reported to be 400. Now, let's just say you were looking at the subject's chart and you really saw it was 180. So you would then just continue and say, as per the medical record dated blank, the blood pressure appears to be 180. The data reported is 400. Please reconcile and update data as appropriate. You always want to make sure you're asking the site to verify. They need to go back to the source and check, make sure that they are taking that step. You do not want to tell them directly, hey, make this correction. So just tell the site what is reported. That's step number one. So what is reported in the system? Start your query with the exact data that's reported in the EDC system. The next step is to tell the site what may potentially be wrong with the data that's reported And in this particular case, we were saying it was inconsistent with what was seen in the source documents. Um, so you'll see that often in CRA queries. In the CRA query, it's unlikely you would see the CRA issue that the value reported is not sustainable in life. Those tend to be more auto-generated queries. The CRA is often looking at source documents, so you'll see them say EDC says this, the source says this. Please go back, verify, and reconcile, and either explain or update as appropriate. The step after telling the site what's wrong is to ask the site to correct or verify, and you really want to be asking that question. Please, please go back, look at the source, and either correct the data or verify it. And the most important thing you need to make sure you do not do is don't lead the site to what needs to be reported specifically. So do not give the site instructions of, hey, 400 is wrong, please enter 180. You do not want to lead the site. These are called leading queries, and they should not be written. So if you feel like reading that query, you are directing the site to do something in terms of not needing to look at the source and just giving them the value, just be cognizant of that. It's a very fine balance, but you want to make sure you're telling the site to please correct, verify, or explain. So either you can correct the data and say it's wrong, you can go back to your source and verify, or you can respond to the query and say data is correct as entered, and if you want, you can also add why it's correct. Data is correct as entered as per EDC, and that's really for, as per the EMR note dated X, and that's really for the study coordinator who will respond to the queries. But those are the principles of query writing. There are a couple of things to keep in mind. One of the things that is often the case across studies, global trials and also local trials, not everyone's first language is necessarily English, assuming you're writing these queries in English. So sometimes you want to make sure you're not using vocabulary that would be hard for someone that's not a native speaker of English to understand. So make sure your queries are extremely clear, and it's very clear what you're asking the site to verify. So I talked about that, and then the other thing you should be cognizant of is the number of queries you're issuing. Oftentimes, if I notice a pattern of things, I'll just tell a site of the pattern and say, please go back and verify. For example, they may have misunderstood the CRF completion guidelines and entered something incorrect on every patient. If I start noticing a pattern, instead of issuing query after query after query, I'll tell the site, hey, I noticed this on 3 patients. Can you go back and check all the patients for this data point? Oftentimes, people don't want you to issue tons and tons of queries. It's not super helpful to the site to have hundreds and hundreds of queries. So if you're noticing a pattern before you go and issue queries for every single instance of it, just tell the site, I've noticed this pattern. Please go back and double check. And often your study coordinator will be more than happy to do so. I think that's really everything I have on query writing. So hopefully that is helpful to you. And those are really the basics. So just the high level, tell the site what's reported, tell the site what is wrong with what's reported, ask the site to correct it or verify, and do not suggest the site what needs to be reported specifically. Also be cognizant of the fact that sometimes people don't necessarily speak English as the first language, and make sure that the queries you generate can be easily understood. All right, I think that's all for this video. I am going to put out another video where I will talk about what sort of positions you should apply to as an entry-level person coming into clinical research. So that'll be my next video. As always, I take topics by request, so please list them down in the comments. If you haven't done so already, please take a moment to smash that like button, and I will see you in the next video. Thank you.